Labor cost optimization is an approach to reducing unintended labor overspend. So it's important because clients need to understand that not only do they have overspend in areas they had an unintended, but how to fix it, how to solve for it, and how to make sure they're getting that money back into their organization. Labor cost optimization in the healthcare provider space is a little different because it is the one type of industry that really has some of the most complex pay policies and pay practices. And it's often one of those that is left unattended, so it's left to the device of the line level manager to interpret how the policy should be leveraged for different employees. And so consequently what happens is over time there's a lot of unintended overspend that occurs because it's not being monitored, it's not being checked. And that's the one thing that our LCO will do, is it will help not only bring it to the surface, but help teach you how to measure and monitor your savings going forward. LaborWise is an advanced analytics product that helps to not only identify the labor overspend, but it also helps to identify ways to fix it. It gives you options around how to understand the insight around overtime as it relates to absences, or as it relates to tenure, or even as it relates to open position requisitions that you might have in your organization or within your department. Because those things are compelling insights to help you understand where I need to focus my efforts to reduce that labor overspend. We have a client who had about 1,000 open positions. And when we brought LaborWise in, they understood that they had a lot of overtime in certain areas, and kind of understood those basic principles, but they didn't understand how those open positions were directly affecting and where they might have productivity issues in areas where they hadn't been filling quickly enough. So we actually identified about $3.5 million worth of overtime that was a direct result of 60 FTE not being hired. And what we did was we helped them focus those FTE hires so that they could reduce that overtime, frankly, very quickly, and not have to wait, months and months to reduce it. It was really in a matter of weeks, and that was really compelling insight for them because they knew that they had open positions that were causing overtime, but the fact of the matter is they weren't sure which ones, and they weren't sure how to get at it quickly enough. And that was what LaborWise was able to help them do. A lot of healthcare executives are really thinking about a couple of things. How do I transition from volume-based to value-based care in our current high-pressure, compliance-oriented environment? And how do I get cost out? And I think those two things go together. I think value-based care is a direct indicator of how you are managing your labor on a regular basis. And if they can take 1% out of their labor cost and apply it to their value-based care initiatives, they'll improve patient care, they'll improve the outcomes of patient care, and they'll improve the employee experience and engagement of the employee to the company.